Hola, hola, we are live. It's showtime. Welcome to Latina Mental Health Series with Latina professionals. You're here with yours truly, Norma Garcia, your mental health and life coach. I can't believe that we are already in October. What that means is that there's only a few more months for the rest of the year. I can't believe how fast it's gone by. Welcome everyone. As you're coming in, please let us know where you're coming from, what industry you're in, also what is it that you're looking forward to in learning about today. Let me set this up. Okay, awesome. Yeah, so welcome. For those that are new, welcome to your first live session with me. Typically, these series are about 30 minutes, and there will be a replay of this at the end. Typically, a topic is brought up all related to mental health. I'll give some psychoeducational information. I'll provide some strategies and tools, and then I will leave some room for questions at the end. However, as I'm doing the presentation, please use the chat to be able to communicate, to bond, get to know each other. Sometimes, it can feel for me just kind of like I'm talking to myself because I only see myself here visually. So your engagement, your participation, asking questions, or even responding to each other's comments and questions absolutely makes this space that much special. For those of you that have been with me from day one, so we kicked off Latina Mental Health Series back in May in honors of National Mental Health Week. So given it's been, a few months now, so for those of you that have been joining me, I truly appreciate your presence and being here. And the intention of this space is to be able to create awareness, to come together as Latinas, to learn together, but also heal together. I'm a big believer in healing in community. So this space is really special for me that I get to bring on such important conversations that may not always be easy to have, but is much, much necessary in order for us to, continue breaking the stigma, right? And really being able to raise awareness to topics that affect all of us collectively and individually, of course. So, all right, let's see where everyone is joining us today. Always love this part. I love to see where everyone is tuning in. And as you can see, right, we're tuning in from different places of the world, and how amazing that we get to spend these next 30 minutes together in this space. For me, I'm truly honored. So I see someone from Texas, someone from Mexico, hola hola, North Carolina, hello California, Nevada, let's see, Illinois. Love it. Ooh, Chihuahua, Mexico. Saludos a todos. Love it. I love also even seeing, the different industries that we're in, right? At the end of the day, right, there's so many similarities and so much empowerment and learning that, can be done in terms of being in this space. So happy that you're all here. I'm super excited for today's presentation. We did a poll a few weeks ago and we heard you. And so one of the topics that was requested was on ADHD, attention deficit hyperactive disorder. And it just so happens that October is ADHD Awareness Month. So what perfect way to be able to kick off this month in raising awareness to this specific condition, this mental health condition that is truly relevant and prevalent, right, in our culture with our children as adults. So we'll get into it in just a second. First, let me introduce myself a little bit more and tell you who I am. Again, for those of you that have heard my story over and over again, I appreciate your patience and just hearing it over again. But my name is Norma Garcia. I'm a licensed clinical social worker and a life coach. I have devoted the last 10 years to community mental health. So what that means is I've had the opportunity to work with the most underserved, underprivileged communities in uplifting and helping them navigate their mental health and healing journey. I've had the opportunity to work in different kind of agencies, from outpatient, school districts, even out in the community, making sure that we are providing the best mental health and also crisis services. My approach is eclectic. I love to incorporate culture, specifically with the clients that I work with, because I believe that is truly crucial in really moving the healing journey forward. I also believe in taking a holistic approach, really looking at the mind, body, spirit, soul, all the different layers that make us who we are. And also I take a trauma-informed lens, really looking at the impact of trauma, specifically when we think about generational trauma and how that is trauma that is passed down from our generations and how it manifests and presents itself today. I'm very passionate in working with my Latinas, women of color, and helping them heal, right, their past emotional wounds and getting them to a place where you can reach your full potential, be the best version of yourself, and really accomplish your dreams, goals, and aspirations. A mission of mine is to continue advocating and educating on mental health, continuing to break generational trauma, and creating any impact I can within our Latina community. Awesome. So let's get started. So I first wanted to, hold on, I want to make my screen bigger. I first wanted to acknowledge October. This month is actually, it's a huge month. There's a lot of things that we're celebrating this month. And so I just wanted to take a moment just to highlight these other also areas that are just as important as mental health. It is Breast Cancer Awareness Month. It's National Down Syndrome Awareness Month. Bullying prevention, National Physical Therapy, Pregnancy and Infancy Loss Awareness, SIDS awareness. There is also a Mental Illness Awareness Week and a World Mental Health Day. There's National Depression Screening Day. There's so many good things happening this month. There may be a few that perhaps I didn't name, but just for you to have awareness, usually every month there is some sort of focus or theme on a specific, topic. So for this month, we're really gonna, focus on these things. And today, like I said, I'll be able to really highlight and talk more about ADHD. So first, I wanted to talk about the term neurodiversity in order to be able to also understand ADHD. Okay, and so as I do the presentation, I'll make sure to take some breaks to also look over the chat to see if you guys have any questions, to make sure that I'm also engaging with you all. So neurodiversity, this is a movement that's fairly new, and essentially what it means is that that there's a belief that individuals have a different way of processing information and thinking that is actually normal, right? So it's a movement to normalize, right, that there is differences in the way that we interpret, process information. And so it's also highlighting that there's actually benefits to having some neurodiversity, right? There's benefits in you viewing things differently or processing differently. This is where we get a lot of the creatives, right? That can bring an element that perhaps, others may not be able to view or process in that same manner. Typically, the common conditions that classify a neurodiverse individual is what you call these neurological conditions, which is autism, ADHD, as we're going to talk about, social anxiety, dyslexia, and dyspraxia. Those are more related to kind of an intellectual disability. Although there are many benefits in being neurodiverse, there is also some challenges that we may face, such as we may be overstimulated, we may have meltdowns. There's challenges with your executive functioning skills, there's rigid behavior, there's social isolation, there's a lot of uncomfortables in new situations. And so these problems, we see them on a spectrum, right? Like everyone has a different intensity of how these problems manifest and come up for you. So today, as I mentioned, we're going to talk about attention deficit hyperactive disorder. Super long name, but essentially the abbreviation that I'll be using throughout is ADHD. This is one of the most common neurodevelopmental disorders. So by the word neuro, right, this has to do with our biology. There is effect in terms of different areas in our brain. As I listed here, right, it really affects your prefrontal cortex, which controls your attention and your organization, and also your limbic system, which focuses on regulating your emotions, your memories, and your behavior responses. And so typically ADHD is a condition that is typically found in your childhood. Usually when you're a child below the age of 12, this is when it's normally diagnosed. However, it is a diagnosis that sometimes goes undiagnosed until you are an adult. So I think more recently, it's been coming up that as an adult, we are starting to begin to be diagnosed with ADHD. And I do feel more recently there has been more awareness, and I think specifically Latinas and women have been speaking up about having late diagnoses. Another thing about this is that ADHD is also underdiagnosed in women in comparison to men. However, like I said, there is a spike in adult women getting diagnosed with ADHD, and not because ADHD just suddenly happened, right? It's because it just was undiagnosed, right? And so as I'm saying that may be true for some of you in here, right? That perhaps you always felt like something was going on, or that you had ADHD, but it was never diagnosed. And now that you do receive the diagnosis, right? It does provide some clarity and some information to kind of help you learn how to navigate better. There are some studies that show that women specifically experience more emotional and psychological distress in comparison to men, right? So we may have lower self-esteem, anxiety, depression, loneliness, right? So let me just check the chat just to get a feel of how everyone is doing. Let's see. 1 second. Oh, what happened? Let's check out the chat. All right. So yeah. So someone also shared that they recently were diagnosed within this last year. Yeah. Awesome. Okay. So what are some common symptoms and signs of ADHD, specifically, in adult women? And so the thing with ADHD, it has to do with your attention or inattention, right? And your hyperactivity, your impulse control, and again, your executive functioning. So here's just a list of just how it may present itself, right? Difficulty, organizing yourself, constantly feeling overwhelmed. Perhaps there's a history of anxiety and depression. You have difficulty, managing your money, There's forgetfulness, right? This is a huge one, right? We're just forgetting things, we're forgetting details. It's hard for us to focus. We're running late to meetings. We're forgetting, important dates. We daydream. If it is that, so these are more like the inattentive symptoms, but if we're talking about like the hyperactive, right, this means like our energy levels are higher. There's more like impulse control, impulse, difficulty with like impulse control, right? Where either you're like speaking, whatever comes to your mind, you're interrupting, you're talking a lot, you can hyper focus on certain things. And so with ADHD, typically it's either you're inattentive, you're hyperactive, or you can have both combined at the same time. And so as I'm, presenting this, please, I don't want you to start self-diagnosing yourself. I know sometimes we can get in the habit of like, oh my gosh, like this is me, this is exactly what's going on. Like I have ADHD, right? I do feel that as yourself, you know your body the best, right? And so you know exactly what it is that's happening. But for the diagnosis, I would definitely encourage, right, to get an official assessment through a trained professional. And so I wanted to talk about, what are the struggles that as women with ADHD may have in the workplace? Some of this kind of overlaps with the things I was mentioning, right? The inattention, having a difficult time, like staying on task. You're easily distracted. You have a hard time paying attention, and this inattention can lead to frustration as well, right? You feeling frustrated, you feeling overwhelmed, which can then create like feeling discouraged. You're like losing your motivation. So it's kind of like a cycle that happens. The hyperactivity, like I mentioned, a lot of physiological fidgeting, being restless, having a difficult time sitting still, having a difficult time, staying, on one task for a certain amount of time, perhaps like talking excessively. You have a hard time with organization, right? Being organized, right? With keeping things, tidy, where knowing things are at. So again, with that forgetfulness, right? That you forget where you leave things or you forget where things are. You also have a hard time with like, managing your time, right? In terms of, meeting deadlines, your projects, whatever assignments that you have. Perhaps it takes you either a lot longer or you get distracted, or it takes a lot for you to like meet your deadlines or again show up to meetings or do whatever responsibilities that you have at work. And also the impulsivity, right? The habit of interrupting others, acting without thinking, saying things without filtering, right? Them first. So as I'm talking about these struggles, are there any additional struggles that you find that you have in your workplace that are not listed? I would love to hear what you guys, or even like what resonated with you as I was describing these different struggles. And although I focus on the workplace, right? This also is true for like your home life and social settings, right? But I wanted to really focus it on the workplace. So let me check the chat right now. Okay. Yes, it's definitely important that we eat. Someone just shared that they were diagnosed at 20. Well, yeah. So again, the diagnoses, right, really provides some clarity. It provides information. It kind of helps you like feel like that makes sense. I get it now, right? Yeah. How can you tell the difference between ADHD and bipolar? Very, very great question. Um, ADHD, like I said, is more like the hyperactivity. And I understand that you asked that question because in bipolar, right, there is an episode of what we call mania or manic, right? A manic episode where it could look like there's like this grandiose hyperactivity, but the difference is, right, that usually that manic episode is combined with a depressive episode. So there's like a super high and a super low. Also, with the manic, it typically involves higher risk behaviors such as, blowing off your money, spending tons of money, gambling, having, engaging in like sexualized behavior. So there's more like there's a higher risk behaviors connected to the bipolar, and the hyperactivity is more like a manic episode versus just the hyperactivity of just like excessive talking or being impulsive. So with bipolar, the intensity is a lot more, and again, it's combined with a depressive episode. Hopefully that helped clarify. Um, all right. And even just, for those of you that are here today and are bravely sharing, like, yes, I have ADHD, or I'm not sure whether I have it, but it feels like I do. I just want to just acknowledge you and praise you for showing up for yourselves today. And even just, sharing that this is something that you experience, because this is also a way that we are connecting and being able to continue, raising awareness. And there's information here that I'm sharing that I may be missing. So please feel free to share, to fill in the gaps where you see needed. And even then, just to be sitting here and have to pay attention, right? I know that can be a struggle as well. So I do also want to acknowledge that. All right, so let's continue into how do we then, thrive, right, with ADHD, right? So although the word attention deficit, right, I don't know if the word deficit, per se is my favorite word, right? Because deficit means like lack of. However, I want to spin it off and be like, how do we thrive, right? Knowing that we're neurodivergent, right, which is a benefit. And also, right, we also have some challenges, again, in terms of our attention, focus, organization, right? So there are some traditional, I guess, neuro-specific, like neurodivergent strategies, right, in which kind of like, if you go by the book, this is exactly the strategies that you use. But I want to invite you, right, to think about, finding a system that's going to work for you. Okay, so when I thought about this, I didn't just want to, have this be, even though, yeah, I'm going to propose, right, how to use scheduling and organizing as a way to help with whether it's the inattention or the hyperactivity. But just know that I want you to find your own system that's going to work for you. And I want you to pull from things that are already working, right? If it works for you, continue doing that. If it's not working for you, or you're still learning, right, seeing what can be applicable, but don't feel like you have to follow, right, the all like the strategies that are specifically for like neurodivergent people. Also, I do want to say that sometimes, having a schedule and having everything written down, right, that sometimes can not leave room for like forgiveness. And what I mean by that, it's sometimes because, let's say, if we create a list of everything that we have to do, and if, let's say, there's a task that we don't get done, or we don't do everything that we want to do, sometimes that may create us to then be hard on ourselves and be like, I didn't do that, I didn't feel productive. So part of that also is being able to, be compassionate in this process, really learning, right, what are your patterns, right? Starting with like, what are your patterns, right? What are your areas that you struggle with, right? Again, is it inattention? Is it organization? Is it like, hyperactivity, right? And whichever it is, first getting an inventory of what that looks like, really gathering information. So sometimes having a tracker, being able to, whether it's like journaling, right? Every day, kind of like paying attention to what you're doing and kind of gathering data. So then you know exactly, how to intervene and what to do. But here are some strategies that can be helpful, right? Again, to keep you on task. Some common ones, right? Being able to set alarms, reminders on your phone, having a to-do list. For some people, this could be having something physical, right? Using a planner or a calendar. For some people, it is your phone. So you finding what's gonna, work best for you. Also being able to break tasks, right? Like sometimes if you think of something that's it's too big, right? It may be so overwhelming. So we need to really break that big task into a smaller task and doing one thing at a time. Being able to minimize any distractions, right? Again, you have to get an inventory of what is it, right, that's disrupting you or distracting you to then know how to intervene. Giving yourself permission to take breaks as needed, right? Giving yourself the time, okay, I'm going to work on this for this time. And then if I need a break, I'm going to take a break, right? Creating a habit of, checking your schedules, right? Checking your schedules, but also leaving room again for you to also learn, right? To also know that you may not get everything done, right? But that everything that you do is for something. I also wanted to really talk about procrastination because procrastination added to ADHD is a combination that is going to make it that much, more difficult. So with procrastination is, really starting with understanding your internal clock, right? Looking within yourself and understanding, okay, when is it that you feel the most productive? When is it that you feel like you're the most alert, have the most energy? What time of the day is that? So that way, right, you can set yourself up to succeed, right? That in those moments, right, although it's difficult, you're gonna do your best to try to again pay attention, get the task done, right? Like I mentioned earlier, being able to break apart the task, right? Like really breaking it down into like smaller goals. And even if it means like those smaller goals, right, writing them out for yourself, using a timer, right, being able to um, give yourself some time, right, to work on a task, right? And if it means kind of breaking it down in like smaller increments, right? So like working on something for like 10, 15 minutes, right? Once you're done with that, either you take a break or you move on to the next task, right? But this is the way that you're also holding yourself accountable and you're also practicing, right? All of this is about practice, right? It's not about getting it perfect. It's not about always getting it right. And depending on also like where you're at emotionally, right? Like there's gonna be days that you're gonna feel organized, you're attentive, you're gonna be able to do things. There's other days that you're not. So just in a timer, setting up a routine, right, that works with you. And even then, like this can be really overwhelming. Like, oh my gosh, like does this mean that I have to keep track of everything, right? And it does not mean that, right? It just means that you need to organize yourself and put things in place, right, that can better support you. And sometimes that may mean making sure that you stick to a routine, right, to kind of help you be on task. So I'm going to take a little pause right now, look at the chat, and I want you guys to share with me now, right? What are some strategies that work for you? What is it that you are doing now that does help you? And let's see if that's something that also could be beneficial for others in this space to hear as well. So let's see. All right. So I'm gonna put some of the comments. We do not have a deficit of attention. We have problems directing our attention to achieve our goals or complete tasks. Beautifully said, right? And the thing about this, it's the practice of shifting your attention, right? Shifting your attention. And the part of this too is mindfulness, right? Being mindful in what you're doing. Um, let's see. I like to put a countdown or analog clock to help me be mindful of my time. Absolutely love this. Something I didn't realize till taking medication is I would describe every day as my body and mind are screaming high 24/7. I didn't realize others weren't living with this 24/7 or were similar. Yes, absolutely. And one thing, I didn't talk about, but medication can be part of the treatment as a way, to help you improve some of your areas, right? Medication is never to cure it or make it go away. It's just to help you have more like stability. And sometimes, yeah, knowing that once you take the medication, it's going to help you then realize, right, what areas or what is it that's happening. Yes, whiteboard, sticky notes. Yes, to think about this is because there is forgetfulness. Having visuals is really important. Again, that visual, it's whatever you're going to find best, right? Whether you want to, put sticky notes like, in front of your desk, reminders, your phones, like some people or some of my clients, like they, use their alarms, and they have so many alarms, like even just like, for example, like alarms to take your vitamins, right? Like, and it's about just kind of keeping yourself accountable. And the hope isn't that, you're always going to have to be on a schedule. You're always going to have to be a routine. But once you kind of get yourself to a place that's comfortable, when you feel like, okay, this is more manageable, like I'm able to get this better, I'm succeeding, I'm building some self-trust, right? The less you're going to have to rely on these techniques. So I have a remote job and it's so hard to focus. Yes, so many distractions. Yes. um, Co-working sessions are really helpful. I started using Scrum methods in my personal life. I keep a giant whiteboard at home with 3 columns: to do, in progress, done, and I add task to sticky notes. My goal is to keep 3 tasks that doing. Yes, love this. Yes, and hopefully, for those of you that are here, can take some of these techniques and also apply them, for yourself. So the last thing, I know that we're already at the 30 mark. The last thing that I wanted to talk about is goal setting, because this is a huge part in terms of how is it that you are, achieving and setting your goals. I like to teach and use SMART goals with my clients, and even I use this for myself in terms of creating goals that are SMART. SMART is just an acronym for specific, measurable, achievable, relevant, and realistic, and timely, right? So specific just means that it's clear, it's specific, it's direct, you know exactly what you want to achieve. It's measurable, is that you have a way to measure the progress or that you've achieved that goal. Achievable, right? That it's realistic, that is something that is possible to complete, especially within that time frame that you do set. It's relevant and realistic, meaning that it aligns with you. It aligns with your goals, it aligns with your values, with whatever, professional, personal objectives that you have. It's timely, meaning that you give it a time frame, like it's start date to the end date, right? And so these are really good, because when we have goals that are unclear, ambiguous, too big of a goal, it's going to feel so overwhelming. And so part of this is really breaking down into small tasks, right? Breaking it down as small as you need to, right? Because when you break it down small and you then start achieving those small goals, again, the more tolerance and the more trust in yourself, like, okay, like that was achievable, I can get that done. And then slowly you start getting to like your bigger goal. So I wanted to leave you all with an example of what exactly that would look like. The simple goal, right, would be I want to be more in control of my emotions. Great goal. However, how can we make it more specific, measurable, achievable, relevant, and time bound, right? So the example here is specific that, I decided that part of that's going to be meditation. I'm going to meditate to be more in control of my stress. Great. How is it going to be measurable? How are we going to track it, right? So here I'm going to use Headspace, which is an app, to be able to track my meditation. Exactly when it is that I meditate, I'm going to, track it. Achievable. I only have to set aside 10 minutes to meditate, right? 10 minutes, right? That sounds realistic, right? Let's say if I would have put, I'm going to set a time 60 minutes to meditate, right? That probably would feel a bit too much. So again, we want to start small. And then from that 10, you can increase it, right? To 15, 20, 30, until you get to where you want to be. Relevant, right? So it's relevant because it's going to help me control my stress. It's going to make me happier. I'm going to be more productive. I'm going to be able to get things done. Time bound, right? When are you going to start? How long is it that you want to meditate every day, for 10 minutes? So let's say here that, I'm going to start next week, and I'm going to meditate every day. This should have been 3 months, but there was a typo. So let's say for the next 3 months, I'm going to meditate for 10 minutes every single day. Right? And so the way that you put all this entire goal together is how it looks in the bottom, right? I will meditate at least 10 minutes per day, every day, for the next 3 months. I'll track my meditation with Headspace and will assess my results in 3 months. Okay, so I share this so that way you can start using this specific method of setting goals. So that way it can help you, right, with your ability to feel like you are able to get organized, accomplish your goals, and feel that you are being, successful in the things that you're doing, and seeing that your areas of struggles are also areas of improvement, and also implementing a growth mindset right? Where you are in a place of learning, and that these learning experiences for you, that there's growth that comes from it, that these are opportunities for you to grow and become better. So with that being said, let's continue, bringing awareness to ADHD and all, all the mental health conditions that are out there. And, let's celebrate, the beauty of being neurodiverse, right? That there's so many benefits that come from it. And that although there are challenges with it, that there's also solutions and that you can also thrive as well. So with that being said, I wanted to leave some room for Q&A. I know I kind of answered some questions, but wondering if anyone had any other questions. I see there's a lot of action going on in the chat, and I love it. I see we're also giving recommendations on different apps that we can use. So Headspace, How We Feel app. There's another one called, I think, Productive, that can also help you keep track. Someone's talking about like a tip they got from TikTok about how to work on cleaning hacks and getting dopamine up. Yes, so dopamine, so the norepinephrine is the neurotransmitter that is connected to ADHD, in which when there are low levels of it, right, it can really impact our dopamine level. Let's see, some other folks are talking about a weekly planner, breaking apart the tasks. Yes. Mindfulness. Yes, this is a huge one, right? Someone using headphones to zone out. Yeah, so mindfulness, again, it's a practice of being able to be in the present moment, to pay attention to the here and now. And it's also that practice of shifting, right? Like someone said, directing your attention, shifting your attention. Yes, here is a website that someone shared, howwefeel.org. I believe that's the app that was shared earlier. Alejandra sharing that she got that getting medication changed her life. I encourage anyone that's struggling to seek help and try to see if they're, yes. So yeah, this is all, you have to really assess what your needs are. And medication is part of the treatment as well. And then her last comment for today. You need to be mindful of decision fatigue, since I don't do anything automatically. Sometimes I just accept I need to do something in a different way. I accept this method is just better for me. And if it takes a little longer or is unusual, absolutely. So this is a part of being compassionate with yourself, like understanding that, yes, perhaps you may interpret things different. You may process things different. However, that also makes you unique, right? And that you are able to get things done. It's just gonna look different for you, and that's absolutely okay. And I love also that idea of slowing down, right? Being able to slow down, be accepting, right? And then being able to come from a place of being able to succeed. All right, so I know we're a bit over time. I will make sure to continue responding to the rest of your great questions. This presentation will be on replay, so after I end the broadcast, it will still appear in Latina Professionals. If it is that you do want a copy of the slide, you can go ahead and send me a DM. Or you can, I will put my email address in the chat for you to send me a DM directly. If you have any other questions about therapy, about coaching, or any other mental health, or you need support in finding a therapist in your state, or have any additional questions, or have a specific topic that you want us to address more, please send it my way. Awesome. Yes, I know we didn't get a chance to talk about body doubling, but that's a great technique in which you set up kind of like a co-working session where you work with someone, right? And there's accountability in being able to do work at the same time. Awesome. Oh, I love this. You guys all have been phenomenal. Thank you all for your feedback. I hope that you're able to take this information and see how you can add, right, and enhance already the strategies and the toolbox that you already have, and how together in community we can continue healing and rising and uplifting each other. Alrighty, thank you all for being here, and I will see you next time. Buenas noches.